Thank you so much for joining me on my YouTube channel and LinkedIn and Facebook. I see y'all. How you doing? My name is Tess Washington, MD, board certified physician surgeon. On this channel, I discuss various ways for you to optimize your looks, love, wealth, and health so that you can live a happier, healthier, longer life. If you're into that kind of content, do me a favor. You know, subscribe. You already know what to do. Listen, we're going to be starting a series, and it's going to be called Hot Medical Topics. During the day, I'll discuss like about a 59, 58-second blurb, and I'll put it on social media. And I'll come to my YouTube channel, and I will elaborate in the evening. And it also will be an opportunity for people if they have questions or if they want to talk about it in like an open forum setting. I absolutely invite any healthcare provider, nurse practitioner, MD, doctor, specialist, anyone to join me. I do not know everything, and I am definitely not going to present myself in that manner. If it's something that I am very well versed, of course, I'm going to discuss it. I mean, I work as a hospitalist, so I do see a lot of pathology, and I am trained in functional medicine, hormone medicine, but there are a lot of rarities, and that's why a specialist is just that, a specialist. They specialize. So, your presence would be more than welcome. Tonight, the plan was for us to elaborate on, I discussed exophthalmos, and now imagine me talking about that in 58 seconds. I think I sound like an auctioneer. and like I was selling some antique furniture or something like that, but I got it done. And so I just basically kind of like hit, but I had like these great additional pictures because I basically wanted to talk about exophthalmos, and I also want to talk about um, exophthalmos that is associated with Broca's aphasia. And I wanted to go into elaborating on Wernicke's-Korsakoff's and the gait abnormality, the kind of word salad. You guys know where I'm going. I think that with it being that we see some people on the big screen, and we're like, oh well, that's a celebrity. That's why they no. These are superstars that are getting common, ordinary, everyday diseases. That with it being that the relationship is all but abolished between the primary care doctor and the patient, just sit down and just have those conversations. And I just, I will not ever, go against anyone's privacy. I've never, if I haven't seen anyone, even if I have seen someone, I'm definitely not going to tell you their business. But I will just simply take the pathology, and I think that I will bring it from a different approach, because as I have a master's in physiology and biophysics, I don't just look at it like this is a condition. I look at it like, what is the mechanism of how do we get here? Because if you got like at least some cookie crumbs as to how you got somewhere, or you kind of like got a trail, if you follow those crumbs, you could probably get out of there. But just throwing drugs at a pathological situation is not the answer. And unfortunately, that's how medicine's practiced, right? But that's not really how, and I feel like, and then also patients are smart. They got the internet, Dr. Google. So you're sitting here with someone who has never taken a medication a day in their life, and now all of a sudden they walk out the door, we give them a shopping bag. Would you? I wouldn't. I'd be like, yeah, okay, I give it to the homeless person. Right up, right. Here you go. Here's something for you. Take all that. Now it's got instructions. You got to take one of them twice a day. But if they understood how they got to the point of needing that medication, and if they had a path as to how they could get off that medication, compliance would increase 100%. In my opinion. I mean, I'm just one person, but I know that when I've had patients who have come to me who have been non-compliant, and even you got to sit down and draw stick figures, they deserve it. We're giving them a drug that they've never had to take in their life. They deserve to understand why they're taking it. So, I just wanted to just take a few minutes a day and just discuss a pathological situation that is on Google Trends. That's exactly what I'm using. I'm like going on Google Trends, like there's a 41-year-old person who had a heart attack. Well, that's something to talk about because there's a lot of people like, oh my God, I'm 41. You know, what if that could happen to me? And we need to know about heart disease in younger people, especially women, and how heart disease presents in women. So the exothalamus is just the initial phase where I would like to elaborate a little bit more on someone who we're seeing in the light, and we're maybe considering some negative things, maybe because of some behavior that individual may have had in the past. But I don't think that's it at all. I think that it is all physiological, pathological, and I have pulled up many citations and many pictures, and I could just show what I assume is going on with her, and how we need to be aware. Because any functional medicine doctor, naturopathic doctor, they'll tell you. So what is Wernicke's-Korsakoff? Why is it there? And why does that syndrome occur, right? Because of the alcohol that leads to shrinkage of the brain, right? And then what happens if you have the deficiency of thiamine? Well, because of the transport system, the sugar cannot get to the brain. And we all know the brain works off of glucose. So it makes sense if you explain it to a person like that, right? But that's a painful disease, because that's someone who could have been like a CEO, have the C-suite, had a whole bunch of secretaries and everything, had their own parking space with one of those signs that said, don't know, but if somebody park here, your car's going to get towed because this belongs to the VIP. And now that person is almost speaking in word salad. And, I don't know if you guys are probably familiar, but it's so uncomfortable because in the initial part, you understand what the person is saying to you, and you're trying to answer, and the words are coming out, and the words are talking about golf and you're thinking to yourself, why am I saying this? That's gotta hurt. It's gotta hurt a lot. And then as the disease progresses, then they don't know what you're saying and they don't know what they're saying. So, I mean, it may be a little bit better, but I don't think it is. I mean, any aphasia is uncomfortable, motor sensory aphasia. So we just need to talk about it, right? And as opposed to like when people get pathological situations, then we say, well, they shouldn't have been walking with their left and their right foot. That's what caused it. No. We got to accept our mortality as physiological beings, and we got to do as much as we can in the preventative medicine realm to just try to make this doggone tissue suit that we got on last as long as we can and not abuse it. And a lot of the abuse that's coming to our tissue suit is not even our fault. The air that we're breathing, the water that we're drinking, the food that we're eating. So some of our possible decreased longevity of life is not even being caused by us. So I figure, like, if I could just encourage people, you already got someone who's not someone, just environmental. Anyone who has a Masters of Public Health, they know what I'm talking about, right? So you already got that going on. So if you could just do your part, you could only be responsible for who? Yourself, right? Because no one else is gonna listen to you but you about you, right? So that's about it. So basically, hey Todd, what's going on? Thanks for joining. Yeah, I was going to do like the full. I have this software, and it's really cool. I can actually have like all these different pictures, and I can have clips from video. I get on AppSumo. I don't know if any of you guys are over on my affiliate marketing website, but man, I loved. I just got to spend 3 seconds talking about that. What I did, I started a year ago. It'll be a year in November, and I went through all the software I had, and I said, okay, I'm going to replace every single monthly thing with a lifetime deal. Now, what I will tell you is there are some things that I decided not to. Like, I'll give you like one. Mailer Lite, Mail Lite. Anyway, I just signed up for it. The mail software says I decided actually that I'm okay with that. I'm okay with paying monthly because I don't know. It's just I got something on AppSumo. I mean, I have SendFox. I love SendFox. That's through AppSumo. But I was like, I just kind of like that platform. So there were some things that you know the monthly is worth it. I'm okay with that. But like for example, I don't pay for Zoom. $549. And that's gone. Replaced with something from AppSumo. I could go down the list, so I'll talk about that over at AppSumo. But my point is, I swear to God, I'm not gonna be able to remember what I was trying. What was I talking about? I don't know what I was talking about. Anyway, whatever I was talking about, y'all heard it. I don't know what was I talking about. I have no idea. But the point is just that I was going to start having hot medical topics on a nightly basis. So join me tomorrow night at 7 p.m. Oh, I know what I was talking about. I was talking about the cool software that I'm going to use for our hot medical topics. So it's kind of like, have you ever heard of like MIRE? I've never used it, but that's what they were comparing it to. So it's like a whiteboard, but it's not. And you just basically, so what I want to do is I want to load all the pictures on there. And then that way I can like go through. I didn't want to do a slideshow. I just wanted to have the pictures like kind of like scooted off on the side. And then I can just bring them into view and then we can elaborate. Because that way if someone had a question on another picture, then I could just go back and forth. Because it's kind of complicated. And another thing, once we start, I want you guys to let me know if I'm talking to Dr. Talk. Let me know. I need to bring it down. I want to make sure that when I relay this info, I'm not on here for no other reason but to bring awareness. And we are, like, for example, Dr. Dre's aneurysm. He said in the magazine he didn't know that an aneurysm could have killed him. And that's important. I respect him for saying that. And so I have a talk prepared on that. With the filler that's being injected in Mr. Johnson. I've been doing that for years. I don't know why it all of a sudden just came mainstream. But, while guys, sitting here talking about us having filler in our lips and our cheeks, at least, let's talk about it. But I was working with a urologist when I was doing it, and he had concerns. And so when I discuss that topic, I'm going to just discuss some of the conversations that he and I had back and forth. So I think it's going to be fun, and if there are any topics that you guys want to hear about, just hit me down in the description box. I got my email and my phone number. You call the office and you can schedule a 15-minute chat and we could jump on a call. And outside of that, I will be prepared with bells on and I'll send out the short 58-second version in social media, and I'll meet you guys on the platform at 7. I'll be starting at the hospital in a couple weeks, and I will be working at 7, so I may have to either move it up or I may have to pre-record it. I don't know. I'll work that out, but we'll just meet live until that time. All right, I Todd, you gonna come back and see me tomorrow? I don't know how to get you off the screen. All right, there you go. It's been a long day. All right. Well, thank you so much for enjoying my channel. Thank you so much for subscribing. You guys are awesome, man. And thank you so much for all the prayers and all the well wishes with regards to my mom. She's doing so much better. And I really appreciate you guys constantly keeping an eye on her for me. And be safe, stay blessed, and I'll see you tomorrow at 7 p.m. on TestMD TV. Take care.